Are there strategies to deal with polypharmacy stigma in bipolar? Managing bipolar disorder often involves using multiple medications at once, a practice known as polypharmacy. While this approach can be very effective, it sometimes carries a stigma. People might think it means overmedication or question the necessity of so many drugs, which can make patients feel judged or misunderstood. But there are ways to address and reduce this stigma, helping patients feel more comfortable and confident in their treatment. One key strategy is good communication among healthcare providers. When doctors, psychiatrists, and specialists work closely together, they can make sure that each medication is necessary and tailored to the patient's needs. This coordinated care helps prevent unnecessary overlap and reassures patients that their treatment plan is carefully thought out, not just a way to give more pills. Explaining this process openly can help patients see polypharmacy as a personalized, evidence-based approach rather than overmedication. Another important step is educating patients about their medications. When patients understand why they are taking each drug, how it works, and what benefits to expect, they often feel more in control. Shared decision-making, where patients are involved in choosing their treatments, also boosts trust. When patients know the reasons behind their medications, they are less likely to feel stigmatized or suspicious about their treatment. Clinicians should focus on rational polypharmacy, meaning they use medications supported by clinical guidelines and scientific evidence. For example, combining lithium with valproic acid for managing manic episodes is a common, guideline-supported practice. Emphasizing that each medication has a specific purpose helps patients see their treatment as thoughtful and necessary, which can counteract negative perceptions. Addressing medication adherence is also vital. Sometimes stigma leads to patients feeling overwhelmed or reluctant to take their medications regularly. Simplifying regimens, using long-acting injectable medications when appropriate, and providing emotional support can help patients stick with their treatment and feel more positive about it. When patients see their medications as a helpful part of managing their condition, rather than a burden or a sign of overmedication, stigma lessens. Healthcare provider education plays a role too. Training doctors and pharmacists in the principles of rational polypharmacy ensures that prescriptions are appropriate and justified. Involving clinical pharmacy specialists in patient care can help prevent unnecessary medications and reassure patients that their treatment is carefully monitored. Ongoing education and peer review processes help maintain high standards and reduce the stigma linked to overprescribing. Finally, addressing the emotional and social aspects of stigma is crucial. Psychosocial support, including counseling and peer groups, can help patients cope with feelings of being overmedicated or judged. Normalizing polypharmacy as a common and sometimes essential part of bipolar disorder treatment helps reduce internalized stigma and promotes a more positive outlook. In summary, tackling polypharmacy stigma involves a mix of coordinated medical care, patient education, provider training, and emotional support. When patients understand that their medication plan is personalized and evidence-based, they are more likely to accept it and stick with it. These strategies help ensure that polypharmacy is seen as a thoughtful, necessary, and effective way to manage bipolar disorder, ultimately leading to better health outcomes and a more positive treatment experience. Always remember to consult healthcare professionals for personalized advice and treatment plans tailored to individual needs.